Patient problems and nursing diagnosis for peptic ulcer based on presenting signs and symptoms. A peptic ulcer is a sore or lesion that forms in the lining of the stomach, or the first part of the small intestine, duodenum, due to erosion caused by stomach acid. It is often associated with Helicobacter pylori infection or the use of non-steroidal anti-inflammatory drugs. Common signs and symptoms of peptic ulcer. Epigastric pain, nausea, bloating, loss of appetite, vomiting, sometimes with blood. Writing patient problems using the presenting signs and symptoms. Epigastric pain, writing it as a patient problem. Patient complains of burning or gnawing pain in the upper abdomen. Nausea, writing it as a patient problem. Patient reports feeling nauseated, particularly after meals. Bloating, writing it as a patient problem. Patient describes a sensation of fullness or bloating after eating. Loss of appetite, writing it as a patient problem. Patient states a decreased interest in food due to discomfort. Vomiting, sometimes with blood, writing it as a patient problem. Patient reports vomiting. Nurse notes possible presence of blood, hematemesis. Writing nursing diagnosis using the presenting problems. Epigastric pain, nursing diagnosis. Acute pain, related to gastric mucosal irritation, as evidenced by verbal report of pain. Nausea, nursing diagnosis. Nausea, related to gastrointestinal irritation, as evidenced by patients complained of nausea. Bloating, nursing diagnosis. Imbalanced nutrition, less than body requirements, related to abdominal discomfort, as evidenced by early satiety. Loss of appetite, nursing diagnosis. Imbalanced nutrition, less than body requirements, related to decreased intake, as evidenced by poor appetite. Vomiting, with blood, nursing diagnosis. Risk for deficient fluid volume, related to loss of gastrointestinal fluids through vomiting. For guidance in preparing patient or client-centered care study and care plans, comment, care study, below. Thank you for watching. Please subscribe.